Hi guys, so I'm going to be talking to you about infective endocarditis. So let's talk about it, describe it. Infective endocarditis is infection of the endocardium. It's when the inflammation is caused by the infection, so in other words, and it's usually with bacteria. Also, this means that an organism has entered the bloodstream. And for those who do not know what endocarditis is or endocardium, the endocardium is the thin, smooth membrane which lines the inside of the chambers of the heart, and it forms the surface of the valves. And its function is to protect the valves and the chambers of the heart. Also, this disorder is associated with invading organisms that attach to the endocardium. You also have a vegetative lesions that form. You have damage to the valves, and you also have emboli and heart failure present or possible. And I added a fact about the endocardium, and it's that the endocardium provides a smooth surface for the inside of the heart. And what this means that this smooth surface allows blood to flow freely, and that is very important because it goes to the tissues. Some signs and symptoms of endocarditis would be fever or chills. You also have heart murmurs, anemia and pale skin. You have unintentional weight loss, decreased appetite or nausea. You have petechiae, Janeway lesions, and also ulcers nodes. You're gonna have night sweats, and you're gonna have splinters, hemorrhages. And I added some pictures here to let you know what they look like. This one is the splinter hemorrhages. It's kind of like a thin line or cutting in the nail bed, and these are more like little tiny bruises on the fingers and the palm of the hands. Some risk factors that you need to know would be that it's immunocompromised. You have IV drug use. You also have artificial heart valves, congenital or valvular heart disease, and gingival disease, and it's disease of the gums. Some preventions that you might want to take is oral care, dental care, and some prophylactic antibiotics per criteria. And some testings that will be done, diagnostic testings, will be blood cultures and echocardiographs. And I added this picture to kind of show you what or how it looks when they do an echocardiograph and how the infection will look. And as you can see here, the endocarditis is in this area. And I believe that's the ventricle or the atrium. And interventions and management. So therapeutic interventions will be IV antimicrobial drug, and these are given in high doses for 2 to 6 weeks. You have home IV antimicrobial therapy. You have repeat supportive care. You also have serial blood cultures, valve replacements or repair if needed or appropriate. Antipyretics, you have prophylactic anticoagulants, and fluid and rest. And some examples of antibiotics would be oral amoxicillin and erythromycin, and you have IV and IM drugs, which is gentamicin and vancomycin. And some nursing managements will be vital signs, cardiac function tests, repeat heart failure. You also have emboli signs, and watch for any risk of PI or dyspnea. So who's at risk for endocarditis? People who have existing the disease of heart valves, for example, aortic stenosis, And people who have went or who undergo heart valve replacements, which are at higher risk of developing endocarditis. And lastly, teaching and goals. So you want to teach the patient good hygiene, such as dental and oral, like I explained earlier. Teach the patient to report signs and symptoms, complications of reinfection, fever, which is an early sign, chills, sweats, back pain, abdominal discomfort, weight loss, headache, fingernails clubbing, which is the most important, the need to avoid infectious people, avoid stress or fatigue, good nutrition, make sure that they do their therapies, their antibiotics, the prophylactic, and monitor blood temperature. And they also at risk for stroke, so you want to make sure that you let them know to report those signs and symptoms. And the goal is to accurately identify the organism necessary for the treatment. And a question to kind of challenge your knowledge is, when caring for a patient with infective endocarditis, the nurse will assess the patient for which vascular manifestation, select all that apply. And I went ahead and added a mnemonic here to let you know kind of the bacterial endocarditis symptoms or way that you can remember, and it's from Jane.